I spoke to you earlier on about private health facility managers who are threatening to withdraw their services. We can't have that, especially in COVID-19. Frank Toblu is the General Secretary of the Private Health Facilities Association of Ghana. He's joining me on the line now. Mr. Toblu, thank you for your time this morning.
Hello?
Yes, Mr. Toblu, thank you for your time. Now, you raised concerns about government now seeing you private health service deliverers as competitors. You've raised a concern about finance ministry and health ministry frustrating you over claims, etc. Summarize for us your concerns, the main concerns that you have in this time.
Thank you very much. Once again, I want to say thank you for having me on your show. Now, the issue is a very straightforward and a simple one. Now, for some time now, we've been having these challenges with the Ministry of Health and Ministry of Finance.
Okay.
Hitherto, our attention was on the National Health Insurance Authority as an institution that deliberately didn't want to pay us. But upon our own further investigation, we got to realize that it was not health insurance at all. It wasn't health insurance. It was the Ministry of Finance and Health. Why am I saying this? I am saying this because if the health insurance has money, they quickly call and release it to us. Now, when we ask them where is our money, the position is that we have not received any money from Ministry of Finance and that we are unable to pay you. And when we do our checks, indeed, we get to know that they have not received money in true sense. Now, when we write letters to Ministry of Health to sit with them to have a conversation and then formulate a strategy, the way forward, so that both private and public will be in business as far as health insurance is concerned, they will never listen to us. They will never invite us. They will not say anything.
Mr. Toblu, the last time you wrote to them, what was the concern and what did they say?
Now, the last letter we wrote to them was on medicine list. Now, they came up with a list that was not realistic, and it was signed by the Minister of Health. Now, we wrote back to him saying that the prices on the National Health Insurance list were actually unrealistic. They are outdated to the extent that some medicines that are sold in the open market at the price of 2 cedis are on the health insurance list at 1 cedi. To the extent that before you even begin to administer such drugs on anybody holding health insurance card, you are making a loss of 1 cedi to start with. So we wanted to have a conversation to agree and disagree on one or two issues and the way forward. They never responded to our request. As I speak to you, no response, and we are bearing the brunt ourselves. Now, we are saying this because the private sector pays their own utilities, they pay their staff, they pay everything that has to do with the maintenance of their facilities. But when you go to the government institutions, the government pay the salaries, pay other bills for them. So if you are treating an institution like this, what is the rationale behind it?
Okay.
What is the rationale?
You also raised issues about the stimulus package. Again, what's that issue exactly?
Yes, the stimulus package, fine. It is for the industry, for which health insurance is also involved, together with the private health facility. But the question is, you owe us so much an amount of money, and you are unable to pay. But you are able to raise money for stimulus package, which of course is a loan facility to us. Now, if you owe me 5 cedis, okay, and then I ask you to pay me the 5 cedis. You say, no, I won't pay your 5 cedis. Come to me for a loan of 4 cedis, 50 pesos, for which you are going to pay me interest. I mean, does it make a business sense in any way? Not at all. Let me answer it. Not at all. It doesn't make a business sense for one bit. Because if indeed you have money for me as a stimulus package, then first of all, you have to pay what you owe me. Then you give me the stimulus package. That would tell me that indeed you are helping me to remain in business. But where you owe me, you are not ready to pay that one. But you are telling me come for a loan to finance your business. What is it? From accounting point of view, it doesn't make sense. From legal point of view, it doesn't make sense. From business point of view, it doesn't make sense.
Right. Some figures have been bandied about. Government itself has said, President Akufo-Addo has indicated a number of times in the State of the Nation address the amount of money that has been paid to the National Health Insurance. How much does government owe you right now?
You see, that statement, His Excellency, the President, said the last time. We came out to say that no. You claim to have paid 1.2 billion, and you eventually owed 1.8 billion. I mean, you've done nothing. Because if successive government, in the previous administration, let's take it for granted that they left a debt of 1.2 billion Ghana cedis. All right? Now, you have come to pay part of it, not all. Let me be very frank here, not all. You made a part payment of that. And then you go back to owe 1.8 billion. I mean, indeed, you are not serving the purpose. Because if you are telling me this...
I just need you to clear it up. So government owed 1.8 billion, and then they paid 1.2 billion, or they paid 1.2 billion, but then there's another debt of 1.8 billion.
Exactly what I am trying to say.
I see.
What I'm trying to say is that when you came into power, you claim to have come to meet a debt of 1.2 billion. Now, you made a part payment. Then you now owe more than what the previous government owed. So where are we standing? If they have paid, we would have been final.
Where do we go from here? What's the next step? I'm sure you have engaged and you have had some answers. At this point, you are threatening to withdraw your services, but we're in very difficult times. Coronavirus is here and the government institutions cannot bear it all. So what's the next step, the next line of action? Again,
come to the point. If the government indeed knows that they cannot cater for the situation in entirety, then they should be able to handle the private sector very well for us to augment the services that is being provided by the public sector. Now, let me even give you a hindsight information. All right? Some private facilities are being removed from the National Health Insurance as I speak, on the ground that, one, they need to have medical doctors to superintend their activities. The fact of the matter is, how many medical doctors do we have in Ghana? Now, these institutions are manned by the physician assistants in Ghana. All right? Now, we have physician assistants in the public sector, and then we have physician assistants in the private sector. Now, the physician assistant in the public sector is working, and then you are asking the physician assistant in the private sector not to work.
So my question is, and I need to move on from this, is that what is the next line of action for the association?
Line of action is that we continue to provide service. That is number one. Number two, in order for us to continue to remain in business, we would surely ask individuals to support us by way of coming to give us some amount of money when the services we render to you is not part of the health insurance.
Okay.
Now, let me tell you something. Something happened at Kolebu yesterday.
I've run out of time, unfortunately, Mr. Toblu, but I get the point. You're still going ahead with the threat to withdraw or not to accept national health insurance cards.
No, the point is we will accept health insurance cards. That is number one. Two, we will also demand money for services that we are not able to provide and then get money for. That one we will surely do.
All right. Mr. Toblu, thank you very much for your time this morning and for explaining things to us. Frank Toblu is the General Secretary of the Private Health Facilities Association of Ghana. Now, the National Service Scheme has begun processing prospective national service personnel for deployment to various sectors across the country. MMDAs, ministries, departments and agencies, education institutions, hospitals, security agencies and private corporate organizations, those interested in hosting any of the service personnel for the 2020-21 service year are expected to put in formal requests to the Secretariat. User agencies are expected to log on to the NSS website to submit the request. Also, attach names, email addresses and contact numbers of 2 officials to this request. Agencies with special needs are expected to contact the headquarters of the Secretariat for further discussions. And all requests must reach the NSS head office by 30th of this month. For further inquiries, you can visit www.nss.gov.gh. That's nss.gov.gh. National service to the nation.